I'm going to be doing the routine maintenance on our in-house lab work machines. This is an IDEX catalyst, and this is for our chemistries. So we have a log of what should be done when. This is a blank version, but it shows us that monthly we should clean the internal components of the analyzer, as well as run a quality control, clean the centrifuge and the waste drawer. So today we're going to start with cleaning the internal components of the analyzer. So to start off, we go to Tools, Clean Analyzer, and then it's going to walk us through a step-by-step of how to do this. So step one is opening the maintenance doors, which we push down on this. This little door pops open, pop it down, and then our doors kind of prop open and allow us to push them up. Okay, so the next step is to remove the black whole blood separator carriers and ensure that there are no sample cups, which there are not. Open this, there's no sample cups. Open this one, and we do have a sample cup, so I'll remove that and dispose of that and replace that, looking for any debris on those, and if there were, we just remove it with a dry cloth. We have Clin wipes here to remove any debris that we find. Next step is we're going to lift the sample drawer assembly. We press down on the center portion here, and the whole assembly lifts up, and there we can see our carousel. So next step is to remove the carousel carefully. Again, we'll make sure we're wearing gloves as well. By this wire handle that's on the center, and pick it up and move it straight out. Then we have our alcohol prep pads that we get from IDEX that are for this. And we're going to wipe around the track of this incubator ring using this new cloth in the same revolution. Alright, and then we're going to wipe each of the optics and ion windows here at the end multiple times in a counterclockwise direction using a new clean cloth. So I'm going to get a new one here. And then I'm going to wipe each of these in a counterclockwise direction. Okay, and then using the optical tissues provided, we're going to dry them, which are Clin wipes. Again, in that counterclockwise direction. And then we'll make sure all the dampness is gone, so we'll give it just a minute. And then the next thing is we're going to place the carousel back into the machine, and we're going to do it the same way. Should go back in exactly as it came out using the wire handle. And settling that in until it doesn't move, making sure that it engages with the two mounting brackets, which it does. And then we're going to lower the assembly that we raised before, and it'll click, and we push that back in to hold it in place. And so it's set in. Once we have the sample drawer assembly back down and latched in place by pressing in on that, next we will close the maintenance access doors by just pulling down on this, and they'll drop down, and you'll just push it all the way down and then push it back up. And it should be about mostly all the way down. And then this lets us know after we're all done to hit done on the screen, and it's going to then initialize, and we'll mark our monthly log. I'm going to be doing a SNAP ELISA test. This is going to be a combo test, so feline leukemia and AIDS test. The first step is that these tests come to room temperature if they're stored in the fridge. These are stored in the refrigerator, so we will pull them out for 30 minutes to come to room temperature. We have our blood samples. They have heparin in them to keep them from coagulating. So we have our SNAP test and our little plastic vial. So with the conjugate, it's going to be 4 drops of conjugate versus 3 drops of our sample. There is a rule of thumb to remember this, that the conjugate is blue. Blue has 4 letters, so 4 drops. Blood samples are reds, and red has 3 letters, so 3 drops. It's kind of a rule of thumb. So start with 4 drops of our conjugate. And then we add in 3 drops of our blood sample. it's all going into our plastic mixing vial. And then we'll close that, invert it a few times to mix it well. And then this is going to be poured into this top circle up here. We're going to pour all of that mixed sample into that window. So now we're waiting for this to go all the way down until it reaches that bottom viewing window. Once we start seeing sample in that very bottom viewing window is when we'll snap it. It is important to keep the test flat and not tilt it and mix it. It needs to remain flat until the test is done. So again, we're just waiting for that sample to go all the way down to that bottom viewing window. Now that I've seen that, I'm going to snap it. So now that I've snapped my test, we're going to set a timer for the allotted time to read it. Every test is different, so you want to make sure to read the instructions. For our feline leukemia and AIDS test, it is 10 minutes. So I'm going to set my timer for 10 minutes, and when that's done, we will evaluate our results. So our timer has gone off for our feline leukemia and AIDS test, and we can see our sample here that the control dot is blue, but there's no other dots. That means it is negative. If we're unsure, we could pull out the instructions that would show us what we should see on here. But with most of these ELISA snap tests, there's going to be a control dot, usually in the center or the top, meaning that the test was ran correctly, and that if it was positive for anything, there'd be another dot that was visual. So we'll mark this as negative. For my fecal flotation examination, we start with 30 milliliters of our solution, our flotation solution. We use Fecasol, which is a sodium nitrate solution. So we place 30 milliliters of that in our mixing cup, along with 3 to 5 grams of our fecal solution, fecal sample, excuse me. So we have our little collector here that is roughly 1 gram. I'll just get 3 of those and place it in our mixing cup. And then thoroughly mix this with the tongue depressor. I want to break up any of the big pieces of the sample and just try to mix it as well as you can with the solution. We're then going to strain it. We can do that using either cheesecloth or gauze. So I'll be using gauze. So I find it easier to strain this into a larger cup and then pour it into the centrifuge or the conical tube. But you can basically take your straining, whether it's gauze or cheesecloth, and place it over where you're pouring it into your tube. But I use a larger cup, just seems to work easier, and place my gauze over the top of that, and then I'm just going to strain my liquid into my secondary cup. Just find that I make much less of a mess this way. So once it's strained, I'll then take this and I'm going to put this in our conical tube. Ours is a 2-piece system. It's the spin stack because we do also use these same tubes for our centrifuge flotations. So once I pour that liquid, I'm going to pour just enough to make a meniscus at the top. And then I'm going to take my cover slip and place that on top of the meniscus. So then we're going to set a timer and let that sit for 10 to 20 minutes. So after our timer has gone off, ours has been sitting for 15 minutes. I'm then going to take the cover slip off of the tube, fluid side down, place that on our slide. And then we're going to put this on the microscope and look at this at 100 times power and look for any eggs or anything that we might see, any signs of parasites. So for a direct smear fecal examination, I start with my slide and I place a small amount of my sample on the slide. We use a wooden applicator tip, that way we just need a very small amount on the slide. That's actually probably too much. So just kind of dip the applicator tip into my sample, and that should be enough. And then I'm going to place a drop of saline onto my slide. Just one drop. And then I'm going to mix that tiny amount of sample with the saline on the slide with this wooden applicator tip. And we want this clear enough that you can read newsprint through. So it's very important not to have too much of your sample that you can't see through it. So once that's been thoroughly mixed, I will then take my cover slip, put that on top of the sample, and then this will be looked under the microscope at 100 times and 400 times power. So for our centrifugal fecal flotation examination, we start the same as the standard flotation. We start with 30 milliliters of our solution, which again we're using Fecosol. Put this in our mixing cup with 2 to 5 grams of our sample. And then want to mix this well, breaking up any large pieces. Use a tongue depressor. And then we're going to strain this. Again, I find it easier to strain this into a larger cup before pouring it into our centrifuge tube. So I'm going to strain this first using our gauze. And then pour this solution into our centrifuge tube. Again, we use a stat spin tube system, so it's a 2-part tube. So I pour the solution into the bottom part first, then place the top portion on, and then pour the rest. So our centrifuge is a fixed angle centrifuge. So normally if this was a non-fixed angle centrifuge, you would fill this all the way up to the top, creating the meniscus, and placing it in the centrifuge and then applying the cover slip. With ours being a fixed angle, we are going to not fill our tube all the way, and then we're going to place this in our centrifuge. So then we'll place this in the centrifuge against a balancer, which is filled to the same amount. And then we're going to centrifuge this for 5 minutes. It's at 400 to 650 Gs, which is roughly 1500 RPM. So we make sure this, when we test this occasionally, that it's at 1500 RPM. So this has been spinning for 5 minutes. So now that we're done, we're going to take our tube out. And again, since we did not have the cover slip on during the centrifuge process, we're going to create a meniscus. So basically just add a little bit more of our Fecosol to create a meniscus and add our cover slip. Then we're going to let this sit for a few more minutes, usually about 3 minutes, just since we had to create the meniscus and the cover slip. After 3 minutes, we will take our slide and then take our cover slip and fluid side down, place that directly on our slide, and we will look at this under the microscope at 100 times power. For our sedimentation fecal examination, we start by placing 30 mLs of water in our mixing cup. And then 2 to 5 grams of our sample. We're going to mix this well. Trying to break up the big pieces. Use my tongue depressor. And then we're going to strain it. Okay, and then we're going to put this into our large conical tube. Once we've done that, we're going to wash the sample with water until the tube is filled. So we're basically just placing more water until the tube is filled, and then I'm going to mix that a little bit. Okay, so our tube is now filled. We're going to let that sit for 15 to 30 minutes. So our sediment has been sitting for roughly about 20 minutes, so we're in that 15 to 30 minute window. So we do have some sediment on the bottom. So basically what we're going to do is decant the supernatant off. So basically all the liquid, we're going to leave the sediment in the bottom and then resuspend that sediment in water again. So I'm just going to pour off the water, leaving the sediment, and then resuspend that again in more water. Again, just filling that to the top of the tube. And then we're going to let this sit again for 15 to 30 minutes. Okay, so our sediment has been sitting for another 20 minutes, so we're going to go ahead and pour off the liquid again, leaving the sediment. We're just pouring the liquid very slowly to leave the sediment at the bottom of our conical tube. And then we're going to resuspend in water one more time. We're going to fill it to the top. And then again, we're going to let this sit for 15 to 30 minutes. So our sediment has been sitting for that final 20 minutes. So our last step is we're going to decant again. So pour off all the liquid, leaving just the sediment in the bottom. And a little bit left. There we go. So the last step is we're going to take our pipette and we're going to basically mix the sediment and then transfer a little bit at a time to our slide. So I'm going to dig in here and get the little bit of sediment in my pipette, place it on the slide, and then cover this with a cover slip. If I can get just one. Cover this with a cover slip, and then we're going to examine this under the microscope at 100 times magnification. Now, we're going to have to do this until all of the sediment has been read. So there's still more sediment in here. So after I read this sediment, I'm then going to come back with my pipette, get more, and put it on a slide and look at that. And you want to do that until all of the sediment has been examined. I am demonstrating how to collect ear samples from a canine. So when we have a canine, he has debris in his ears, we want to collect a sample of this for an ear cytology. I'm going to gently open the ear flap, and with my cotton applicator, I'm going to try to get as big of a sample as I can from the actual ear canal. Obviously, I don't want to go too far into the canal to cause damage, but I want to try to go into this vertical canal and try to collect a sample. So gently, and as I get the applicator in, I'm going to rotate it slightly, trying to collect a sample, trying to collect some of this debris. And once I place that down, then I'll go to the left ear. Again, just opening this ear flap and gently placing the swab into the ear canal and rotating to collect some debris. And then we mark this, we break the end of it to mark the left ear so we know which swab is which. I'm demonstrating rolling out an ear cytology. So we have our samples on our cotton applicators. So we at our clinic have a designated side of the slide for each ear. So knowing that this is the left ear, because we broke the end of the applicator and be rolling it on the left side of the slide. And I'm not applying pressure because that can destroy cells, but I'm just gently rolling this along the slide. And it's about a quarter of the slide. That way we have this side for the left, a gap in the middle, and then the end for the right. So now that I have my right side applicator, I'm going to gently roll it on the end of the slide. Again, not applying pressure, just gently rolling this along the slide all the way from the top to the bottom. I will then gently heat fix it, and the reason we heat fix it is a lot of times this debris in the ear contains wax, so this will melt any of the wax on there and then just adhere any of the moist sample that's on the slide. So I'm not applying the heat directly to the slide, I'm just gently waving it underneath the slide, just enough to apply some heat to the slide. I'll then give this a few minutes to let it air dry. And why I do that, while it's air drying, I label it with my patient first and last name. So in case we have multiple slides that look similar, we know who this is. So now that this has air dried for a few minutes, I'm going to stain it. We use a quick stain. This is a 3 stain process. Let me turn this a little bit. So using this, we're going to start with the first stain. We have our 1, 2, and 3 stains. So starting with the first, we're going to dip the slide into the stain 30 times, or you could allow it to set in the stain for 30 seconds. Our protocol here for our doctor is 30 repetitions, but roughly we just want to make sure it goes in there for about 30 seconds. We want to make sure the entire slide, all of the sample is going into the stain. Once we hit our 30, then I'll tap off the excess and go to the next. Again, once I've reached 30, I'm going to tap off the excess and go to the last. And once I've reached 30, tap off the excess on against the glass, and then I'm going to come over to the sink, and I'm going to rinse this with distilled water, just a gentle rinse on both sides of the slide, and then we're going to let this drip dry. So we set it up in a vertical fashion, so this slide, I can show you, is going to drip dry down onto the gauze. And once that's dry, then we'll read it. So for examination of our ear cytology, we start by placing our slide on the microscope. We're then going to turn our objective to the oil-powered field. So this on our microscope is 100 objective, and it is our oil-powered objective. So then we're going to move our slide out and place a drop of immersion oil. I'll place a drop on each side, so one where our left sample is, and then one where our right sample is. And then turn on our microscope, and I'm just going to kind of aim my lens right over where that immersion oil is, and then raise my stage up until I see the lens kiss the oil. I'll then look into the microscope and adjust as needed my brightness. And then I'm going to use my slow adjustment to focus this until I see my sample on the microscope. Alright, so once I have my field in focus, I'll then start examining this, and we're looking for possible yeast, bacteria. Those are the common things, different types of bacteria. Right now I'm seeing lots of rods and cocci. Poor little puppy dog has a pretty bad bacterial infection, was what this looks like. But I'm going to start, once I have it in focus, I will then move my lens to one corner. So I tell everyone, get a routine on how you look at these. Pick a corner and always start at that corner, so then you kind of just have your routine. So I'm my corner that I start in, and make sure I'm still back in focus, and then I'm just going to pan back and forth and up and down the slide, viewing the entire thing. So again, I'm still just seeing rods and cocci on here. No yeast yet. Once I had completed looking at this left ear sample, I then moved my lens over to the right. And same thing, I start at that same corner on my right, focus, and start viewing. Once I get this into focus, start finding and just start counting. Usually I'll have a little piece of notebook paper here to take notes of what I'm finding as I find them. But again, just viewing each field and then going across and then down is how I do that. But like I said, everyone has their own way of doing it. But just making sure you view every field on the entire slide. And this ear looks, again, pretty severe bacterial infection with rods and cocci. I have not seen any yeast yet or anything else. some epithelial cells in here as well, which is to be expected. But that is examining and that is the examination of our ear cytology. So for collection for our DTM culture, wherever our lesions were, so let's say he had some lesions around his neck area, we would collect a few samples from around that area. So for wherever we're going to collect, we would just clean the area with alcohol to try to get rid of any surface bacteria. And then using our hemostats, we're just going to pluck a little bit of hair from that area. And then with our culture, we actually want to place the specimen and push it down into the media below the surface. So we're just going to push that in there. And then I'm going to collect another sample, let's say go over a few inches. And we'd want to do this probably 3 or 4 times around the lesion. And then we're just going to place this in our media. And then we're just going to leave the cover on loosely, and this is going to go into a dark place. We put it into a cabinet at room temperature, and we will observe this every day for any changes.
So our indications for fungal testing usually are lesions. This is more common on felines and canines, but we can see it on canines, especially younger puppies or dogs that have been strays for a while. But usually we see hair loss, circular lesions. That is the typical presentation for things that we worry about, such as ringworm or other fungal infections. So usually when we see cases present like that, we will then do a DTM or a fungal culture.
So after our culture has been sitting for incubating for at least 10 days, we do 10 to 11 days here, but we're checking for any growth or color change. With these, the color change is usually a reddish hues. Or there would be, like I said, fungal growth. But as you can see, there's nothing, no growth, no color change. It looks perfectly normal. If there was anything where we want to view this microscopically, we have 2 ways. We can just take this off and literally put this under the microscope and view it. Or we can take clear tape. Angle this down so you can see what I'm doing. So we take clear tape and basically wherever the mold boards were, we would press this down over that. And I'm going to get some stuff with that. But we would press this down and then place this directly over a slide. Like so. And then we could view this under the microscope. And what we were looking for is budding yeast buds. We'll also see hyphae, different kinds, different shapes. There's just different things that you're looking for to help basically identify what specific fungi it is. But usually it's budding yeast, and then how many and what they look like, and then hyphae is also the other thing that we're looking for. Okay, I'm going to be performing a skin scraping. So on this, we do have the area shaved, which is, you know, it's good if you can. If not, especially in certain situations of depending on what you're looking for, you don't necessarily have to clip that area. So we're using a 10 blade. First step is I'll get my blade and apply mineral oil either to the blade or the site itself. So I'm going to get a small drop of mineral oil and apply it to the site we're applying the skin scraping. And then I'm holding my blade at an angle to where we don't want to do an angle where it's actually going to cut into the skin. So I'm trying to remain as parallel to the skin as possible. And we're going to scrape until we see some bleeding. The reason for that is we want to make sure we go all the way through the skin until we see a little bit of oozing to know that we've gotten a good sample. So holding the blade with my thumb and forefinger, I'm just going to scrape the area. Again, remaining parallel to the skin. With a very gentle touch. Until I see a little bit of blood. Then I'm going to go over to our slide and apply mineral oil to the slide, 1 drop. And then scrape the contents from the blade into the mineral oil on the slide. I ideally we're going to sample multiple areas on our patient depending on what we're looking for. Once we have our sample on the slide, I then take a cover slip, place it over the samples we obtained, and then I would read this. So for valuation of our skin scraping, we have our sample, our cover slip has been placed on top. We're going to place this on our microscope, and we're going to view this on our scanning power, which is 4 times power. So I make sure I have the correct lens selected, and then I'm going to adjust and bring the stage up until my sample is in focus. And then I'm going to scan the entire field, so I start at the same corner every time and view across. And I'm looking for mites is really what we're looking for here. Anything pretty much that moves. Sometimes you will find them deceased though. But I'm scanning each field looking for anything abnormal other than just debris and hair and skin cells. Looking for any mites, any parasites that we might find. And usually, like I said, you're looking for movement, but sometimes you will find them not moving. So I'm going to make sure I view this entire slide, basically our entire cover slip, before I get my final results. So I finished viewing my skin scraping sample. I've looked at the entire field on my slide and didn't find anything abnormal. No mites, no parasites of any kind. So we would call this a negative sample, but again, ideally we would look for moving little mites on the slide, but we don't always see them. And sometimes, like I said, you will find them deceased or non-moving on there. But nothing abnormal on this sample, so luckily for this dog, it's a negative skin scraping. For our necropsy, we are wearing the proper protective equipment. We both have on gowns, gloves, masks, and caps. And then Dr. McElroy will be performing our necropsy today.
Hi, I'm Dr. Lori McElroy. I will be performing the necropsy. We have draped our patient. This happens to be a dog that was hit by a car. I'm going to be making a midline incision from the xiphoid down to the pubis. I'm going to open the abdominal cavity to expose the abdominal organs. And basically just going to run through all of the organs in the abdomen, starting with the liver, gallbladder. We have the stomach as it goes down into the small intestines, which feeds into the large intestine, or the colon. We have the spleen on the left-hand side. This particular spleen has ruptured, probably due to the trauma. We also have a left kidney and a right kidney. Adrenal glands are lying next to both of those kidneys. And on further down, the urinary bladder, which has also ruptured because this was a hit by a car. We want to assess for any lymph nodes that would be enlarged, because those would be things you'd want to take samples of. Free fluid in the abdomen, or any changes to the outside texture of any of the organs. Then you would want to take samples as appropriate. So I will take one biopsy here. Of the part of the spleen that I can get to. And place that in this formalin jar.
And this would be labeled with the patient's information, so date, patient's name, ID number, and then what it is. So we would label this then the spleen.
And then I'm going to take a sample of the small intestine. Place that in a jar.
And this would be labeled the same way with the patient's information, and then it is a sample of the small intestine.
That is how you perform a necropsy on a patient and collect samples.
So we just performed our necropsy. I'm now going to label these formalin jars appropriately. So I'll put my patient's name, first name, comma, last name, the doctor, which is Dr. McElroy, and then information about the patient. So he's a canine, and then his ID number, today's date, and then what it is. So this is a sample of his spleen, so then I will put spleen. And then I'm going to do the same thing for the second one. Date, patient's name, first name, last name, Dr. McElroy, canine with the ID number, and that this is the small intestine. In all cases where rabies is suspected, the animal and specimen should only be handled by clinicians and technicians who have been pre-immunized for the rabies vaccine. They should have their serum titer tested, and it should be greater than 1 to 5. When we're doing small animals, we make sure we are double gloved. We also wear protective masks and goggles. We'll wear aprons as well. For larger dogs or larger animals, we will wear rubber boots, vinyl gowns, and face masks as well as the double gloves and eye protection. The process is the head is removed by disarticulation at the atlanto-occipital junction, and then the head itself is placed in a refrigerated container with ice packs, not dry ice. There will be forms that are going in with it. They are bagged separately than the specimen. The remaining carcass then needs to be double bagged in a red biohazard bag, and that then needs to be labeled as a rabies specimen, and it's actually disposed of as a biological hazard. So we are in contact with our crematory service, who takes care of all of our specimens, and we let them know that this is a rabies specimen, and they do dispose of it as a biohazard. Okay, we're going to be doing a vaginal cytology. So the first thing, we're going to prep the area. We are going to flush the vulva with some sterile saline. And then I have on my sterile gloves, I have my sterile cotton applicator that I'm going to take out and then apply a small amount of sterile saline to the tip to moisten it. I'm going to insert the applicator at about a 45-degree angle into the vulva, about 1 inch to 2 inches. I'm going to slightly rotate it to collect a sample and then remove. I will then roll this sample onto a slide, just a small amount, probably about 2 rolls, not applying pressure, just a gentle rolling of the sample. And then we will allow this to dry and stain. So I'm going to be staining my vaginal cytology sample. So this has already been rolled out on our slide. We're then going to use the Dip Quick system. So with this, we have our stages 1, 2, and 3. We'll start with stage 1, and we're just going to immerse each sample, immerse the sample into each stage for 30 seconds. You can plunge if you want. Here we'll try to do 30 repetitions, but usually that adds up to 30 seconds. And it's just making sure we cover the entire slide, the entire sample. We'll then move on to the next one, and again for 30 seconds. And then finally, the third stage for 30 seconds. Okay, that's been 30 seconds, so we're just gonna kind of tap it on the edge of the glass just to get any drippings off. Then we're going to rinse this with this distilled water over at our sink. And then block this in our paper, our bibulous paper. We're just kind of getting that final dry to it. You can see I've got my book of paper and I'm just got my slide in there and just tapping it lightly. Alright, this is still a little wet, so we'll let it air dry the rest of the way. So I'm just going to place some gauze on the counter and then let my slide rest there and air dry, and then we'll read our vaginal cytology. So we're going to be viewing our vaginal cytology. So we start by placing our slide on the microscope. We're going to be viewing this under high oil power field. So we start by placing a drop of immersion oil on our slide. And then I'll turn this to our 100 objective lens or our oil power objective lens and raise my stage up to the oil and bring this into focus. So as I'm moving around, and first thing I'm kind of noticing is the majority that I'm seeing are parabasal cells. I'm also seeing some intermediate cells, but mostly what I'm seeing right now so far are parabasal. I'm seeing quite a few of them. It's pretty much what most of my field is so far, with some intermediate cells. So I'm thinking, as I'm looking at this slide, at the history that presented with this patient, there was no history of a recent estrus cycle. A young female dog was not, presenting to male dogs. I am seeing one superficial cell here, but so far still mostly parabasal cells. So thinking about, okay, we're seeing mostly parabasal cells. Again, no history of a recent estrus cycle, and kind of just the history of this dog. More than likely, I would be thinking of placing her in an estrus. That's just kind of going with the history and what I'm seeing here. I am seeing a neutrophil. But again, I'm still mostly 90% of what I'm seeing is parabasal cells, which that does go along with an estrus cycle. But without kind of knowing, a history, sometimes diestrus and an estrus can kind of go hand in hand, or metestrus and an estrus can go hand in hand. So without knowing a history, it is really, really difficult to be able to stage what cycle they're in unless we have a history. But again, no recent estrus cycle. Still seeing mostly parabasal cells. One more neutrophil there, and a few more intermediate cells. But 90% is parabasal cells. So I would continue looking at this just to, try to get, look at the entire cytology just to make sure nothing's missed. But with 90% of the cells I'm seeing is parabasal cells, and given the dog's history, I would put her in an estrus cycle. So the 4 stages of estrus start with an estrus. An estrus, the patient will present with no vulvar swelling. She does not attract male dogs. What we would see on a cytology is predominantly non-cornified squamous epithelial cells. These can include parabasal, basal, or intermediate cells. We will see some neutrophils, but no red blood cells, and this cycle lasts for about 4.5 months. The next cycle is proestrus. The patient would present with a swollen vulva with reddish vulvular discharge. She is attracting male dogs but is not accepting them. It lasts for about 4 to 13 days, but the average is about 9. We usually see about 9 days. What we would see on the cytology, if she was in the early stage, we would see a high number of red blood cells along with basal and parabasal epithelial cells. As the stage continues, we see the number of red blood cells decrease, and the epithelial cells start showing signs of cornification. So we see the pycnotic nuclei. Late into proestrus, almost all of the cells present are intermediate cells with the pycnotic nuclei, and we still see some neutrophils. We then move on to estrus. So the patient would present with a recent proestrus stage. She would have a swollen vulva with possibly a pinkish to straw-colored discharge that then becomes whiter, and she is accepting male dogs. That's kind of very important when it comes to getting our history. On a cytology would be pretty much all squamous epithelial cells are cornified at this point in time and visually anuclear. We don't see any neutrophils and just a small number of red blood cells. This cycle lasts, again, average 4 to 13 days, but most of the time we see around 9 days. And then lastly is metastrus. With this, a patient presents with a history of an estrus cycle. Vulvular swelling and the discharge have decreased, and she is no longer attracting or accepting males. On a cytology, we would see cornified squamous epithelial cells have been replaced by non-cornified squamous epithelial cells, and usually neutrophils will increase during this until about the 3rd day of this cycle, and then they start to decrease. We don't see any red blood cells at all during this cycle. And this lasts for about 2 to 3 months. And without a history, metastrus and an estrus can be hard to differentiate between, but again, a lot of that would be based on history about recently the female being accepting and attracting male dogs. But that are the 4 stages of estrus. So the first step for our cross-matching for blood transfusion is we have our samples. So we have both a serum and then whole blood in an EDTA tube for Bear, who is going to be our donor, and then Snowball, who's going to be our recipient. So the first step is we're going to take our whole blood in our EDTA tubes, and we're going to centrifuge them for 10 minutes, and then we're going to remove the plasma from them. So we're going to centrifuge these for 10 minutes. Okay, so now that our EDTA tubes have been centrifuged for 10 minutes, we're going to remove the plasma from the tube. So this is Bear, our donor, and then we have a plain white tube with his name labeled as well. So we're going to take the plasma off of the EDTA tube and place that in the plain top tube with his name. So then we have, which I guess I should angle this down a little bit, you can see. But so then we have a plain white tube with just the plasma from the EDTA tube for Bear, our donor. So I like to keep these as organized as I can. So then we're going to do the same for our recipient. So we have his plasma spun down, and we're going to remove that. So then we're going to remove the plasma, do the same thing. So then we're left with, show you all 4 tubes. So for our recipient, we have the plasma, and then what we're left with is pure red blood cells. And then for our donor, same thing, we have the plasma separated, so all we're left with is pure red blood cells in an EDTA tube. So then we're going to perform our wash. So we're going to take 3 to 5 drops from each of the pure red blood cells of what's left in the EDTA tube, and then we're going to mix that with some saline. So try to keep everything as organized as possible. With a pipette, we're going to take our recipient snowball and take 3 to 5 drops of his pure red blood cells. So I'm going to do 3 drops, 1, 2, 3, into a plain white top tube. And then same thing for Bear, our donor, pipette, and we're going to get 3 drops of pure red blood cells and put it in our plain white top tube. Okay. So then, in these 2 tubes, so then like I said, we have just plain red blood cells. Forget where my camera's at. Plain red blood cells in these white top tubes. So then we are going to add 5 mils of saline into each of these tubes. And it should fill the tube up. So then each tube has 5 mils of saline in with it. So this is going to be washing of the red blood cells. So we're then going to centrifuge these tubes for 2 to 5 minutes. So put these 2 of our washes into the centrifuge for 2 to 5 minutes. So our wash, or our red blood cell suspension, has been centrifuging for 5 minutes. So we're then going to pour off the supernatant. So we see that we have the red blood cells there at the bottom, and then just the liquid, the supernatant, all the way up to the top. So we're going to pour this off, and here's our other one, and then resuspend it. So I'm going to turn this camera around. So, to do that, turn around here to our sink, and we're just going to pour off the saline, our supernatant, so we just have our packed red blood cells. So there is our recipient, and then we're going to do our donor. And you can use a pipette, so if you want to use a pipette to get the supernatant off, you can do that as well. Just kind of takes a little bit longer, but we're just getting all the supernatant off. We have just the red blood cells. So we're back to just the red blood cells. So then we're going to turn back around again. And then we're going to add more saline. So we have more saline, 10, so 5 more into each tube. And then we're going to centrifuge this again and do a second wash. So 5 more into tube 1 and 5 more into tube 2. Okay. And then we will just invert these a few times to just mix them. Make sure the lid is on. And said just mix these, and then we're going to centrifuge them again for 5 more minutes for our second wash. Okay, so our second wash has finished centrifuging. So we're going to do this one more time to do a third wash. It looks pretty good because our supernatant is clear. But I'm going to just decant the supernatant, leaving just the packed red blood cells here in the bottom. Get my little little test tube holder. Comes in handy. And then do our second one. And what you're looking for is a clear supernatant. In this one, these are clear, but ideally it's best to do at least 3 washes. So we're going to do 1/3 and final wash before moving on. But if after the 3rd wash, if the supernatant was not clear, you'd want to continue with the washing system until your supernatant is clear. Okay, so now that we have decanted, we're going to add our 3rd and final wash. So 5 more mils of saline into each tube. And then centrifuge one last time. And then we should have our wash for our suspension. So we're going to do a centrifuge one more time for 3 to 5 minutes. Okay, so our final wash, our 3rd wash, has finished centrifuging. So we're just going to decant the supernatant off. And like I said, this should be clear, which it is perfectly clear. You can see that is clear. Nothing mixed in there with except our red blood cells. So we're just going to decant all the supernatant off of here. So there we have pure red blood cells for Snowball, our recipient. And then we're going to do the same for our donor. And so now we just have pure red blood cells for Bear, our donor. And then we try to leave, like this has 1 drop of saline left in it, so you can see it's resuspended, which is what we want. And then Snowball's looks about the same. It's a little loose, at least it's resuspended. If need be, we could add 1 to 2 drops of saline to resuspend the pure blood cells. But then we have our final wash and our suspension of pure red blood cells. Okay, so the next step would be to make our major cross match. So we have a tube labeled major, and then we're going to take 2 drops of the plasma from our recipient. So that plasma we pulled off when we spun down the EDTA tubes. So 2 drops of the recipient plasma into our major tube. And then that's going to be mixed with 2 drops of the suspension from our donor. And then there we have our major. It's labeled with our donor's name, Bear, and then major. So for our minor cross match, we're going to do the exact opposite. So we have a tube labeled minor, and we're going to get, let me get a pipette, excuse me, get 2 drops of our donor's plasma that we got when we centrifuged the EDTA whole blood. So 2 drops of donor plasma. To 2 drops of the recipient red blood cell wash or suspension. So 2 drops of the recipient's suspension, red blood cells. And so that then creates our minor cross match. And then lastly, we want to do a control. So we have 2 tubes labeled with the donor's name and the recipient's name. And basically what we're going to do to make a control is to do 2 drops of the donor's plasma and the red blood cells in 1 tube, and 2 drops of the recipient's plasma and red blood cells in 1 tube. So basically creating their own control. So, get my pipettes here. And so I'm going to make Bear, who's our donor, going to make his control. So I'm going to do 2 drops of his plasma. And then 2 drops of his suspension. And so we have his control. And then Snowball, our recipient, I'm going to do 2 drops of his plasma. And then 2 drops of his red blood cell suspension. And so then we have his control. So now that we have all 4 of our samples, we have our major and minor cross-match and then our 2 controls. We're going to incubate all 4 of them, ideally at around 98 degrees Fahrenheit. You can do room temperature. It can reveal accurate results. So we're going to do that for 15 to 30 minutes. Since we're doing room temperature, we're going to do 30 minutes. So I'm just going to place all 4 of my tubes in my little tube rack here, set a timer for 30 minutes, and then we will centrifuge them. Okay, so our samples, our cross-matching have all been incubating for 30 minutes. So now we're going to centrifuge all 4 tubes for 5 minutes. So we have our major and minor cross-match, and then both our controls are going to be centrifuged for 30 minutes. Or excuse me, for 5 minutes after incubation of 30 minutes. Okay, so all 4 of our tubes have finished centrifuging. I have them here in my test tube rack. So our next step is just to visually look at them and see if we see any agglutination. So looking at my major, there might be a little in there. It's kind of hard to tell from here, but the very base, there might be a little bit in there. Minor looks a little bit better. There still might be there at the very pinpoint. There might be in some there, but sometimes it's really hard to tell with the naked eye. That's why we look at it microscopically. Snowball's control looks a lot better than Bear's control, so we'll worry about Bear. Bear might not be a suitable donor, but we'll see what we see under the microscope, because it's really hard to tell with the naked eye sometimes. So we're going to look at each of these individually. I'm going to start with the major. So I'm just going to get a drop of major. Let me get my cover slips. A drop of my major cross match and place that on the slide. And cover that with a cover slip, and we're going to take a look at that and see what it looks like microscopically. And again, we're looking for agglutination, hemolysis, any signs that these guys might not be a good match. So for most of this, I'm seeing mostly free cells. There appears to be maybe some agglutination. I'd probably put this as a grade 1 maybe, because I do see some agglutination, but mostly free cells. Everything seems to be looking pretty good here. Just minor, there's just some spots here and there where there's some agglutination, but overall looks pretty well. Okay, so then we're going to do the same thing with our minor cross match. Going to look at that microscopically, so I'm going to get a drop of that on our slide here. and cover it with a cover slip. And let's take a look at our minor cross match. And again, we're looking for agglutination, hemolysis. So I am seeing some agglutination here as well, maybe a little bit more than our major cross match, but for the most part, free cells, everything seems to be doing well. Just again, spots here and there, I again would grade this a grade 1, just some minor agglutination. And so lastly, we're going to take a look at our controls. Turn this around. So first I'm going to look at Snowball, who's our recipient. We're going to look at his control. And this just verifies that, you know, good recipient, good donor. You know, if we find anything on these controls and we know that maybe neither one of them are good for it to be recipient or donor. So Snowball is control. I'm not seeing any agglutination on Snowball's control. Everything seems to be moving freely and looks very uniformed. It looks fantastic. Alright, good for Snowball. Okay, and then lastly we're going to do Bear, our donor's control. Put a drop of that on a slide, cover it with a cover slip, and let's look at Bear's control. This is important to know if he can be a good donor, I mean not just for Snowball, but and I'm not seeing any agglutination either on this control. This looks beautiful. Everything moving around freely and just looks fantastic. No agglutination. Alright, so based on this, so like I said, I graded both our minor and major controls a grade 1 just because there were some small agglutinations, but overall everything looked really, really well. And so I would give this a green light for blood transfusion for Bear to donate for Snowball.